Before you get a dental implant, you need to hear this. Dental implants are often sold as a simple, one-time fix. A screw in the bone, a crown on top, and you're done. But that's not the full story. Because before you spend thousands of dollars, before you go through surgery, before you commit to something that stays in your jaw for decades, there are a few things most people are never told. And in the wrong situation, an implant can turn into very long and very expensive problem. And don't get me wrong, dental implants can be an excellent choice. For the right person and in the right situation, they can last for decades. But they are also the most expensive tooth replacement option, a surgical procedure, and something that requires lifelong maintenance. So before you say yes to an implant, here are the things I wish every patient knew first, because this information could save your mouth and your money. Let's start with the biggest surprise, the real cost of implants. Most people only hear the price of the surgery, the price of the implantation procedure. But an implant is not just one thing. It usually includes the implant screw, the connector, also known as abutment, the crown, possible bone graft, x-rays, surgical visits, and follow-ups. Depending on the case, the initial cost alone can easily be $3,000 to $5,000 per tooth, or even more. And here's the part most people don't realize. That's just the beginning. Implants require maintenance for life. After the implantation, you'll need professional cleanings, x-rays when necessary, and regular implant checks usually every 6 months or at least once a year. And you can be sure those visits cost money too. Over 10 to 20 years, an implant often becomes the most expensive option compared to the bridges or dentures. So it's not just pay once and forget. Rather, it's commit for life. Now here's another reality. Implants are strong. They're very strong. Success rates are often above 95 to 98%. But they are not indestructible. Here are the most common reasons implants fail. The implant may not integrate to the bone may shrink around it, the screw can loosen, the crown can crack, or infection around the implant. These problems are not common, but they do happen. And when they do, repairs are often complicated, expensive, and time-consuming. And here's something many people don't realize. If you lose the implant, it's not always easy to just put a new one. Fixing an implant can be very different from fixing a tooth. Sometimes there isn't enough bone left, or you need a bone graft and you must wait months and months before trying again. So it's not like replacing a filling. It's a major process. Many people think, if I get an implant, I don't have to worry about cavities anymore. And that's true, implants don't get cavities, but they get something else which can be far more serious than a cavity. Peri-implantitis. That's basically like gum disease or peri-implantitis around the implant. And it can destroy the bone, loosen the implant, and ultimately lead to implant loss. And here's the important part most people don't even think about when getting an implant. Implants often require even better cleaning than natural teeth. You'll need careful brushing, interdental cleaning, and regular professional maintenance and checkups to catch potential problems early. So implants definitely are not a lazy person's solution. They're actually for people who are ready to take oral hygiene very seriously. That's why I've made a free oral care routine guide that helps you take the best possible care of your teeth, whether or not you have implants. You can download it completely for free. Link is in the description. Now, this one is something rarely discussed. Most patients love their implants, but not everyone. I once had a patient who came after treatment and said, "Hey, I want the implant removed. I can't live with it." Then I asked, "Why do you want it removed? Is there any pain in the area?" And this is where it gets interesting. There was nothing wrong with the implant. No pain, no infection, no technical issue, nothing. But he said, "It just feels strange. It doesn't feel like my own tooth." And it caused him serious anxiety. So we booked an explantation visit, which is the procedure we remove the implant, but he never came. He eventually got used to it. Stories like this are rare, but it happens. This just shows that an implant is not a natural tooth. It's a foreign titanium screw in our bone. And for some people, their body or mind just doesn't accept it. And that could cause real problems. Now, this is very important information. All implants are not the same. First, there are two main parts in the implant. The screw part, which goes into your jawbone, and the crown part, which is the visible part you can see in your mouth. And there are two main ways the crown is attached to the implant. The first one is cemented crown, the second is screw-retained crown. And in most cases, screw-retained is better. Why? Because it's easier to remove, it's easier to repair, and it's easier to clean. There's no cement left under the gums. But here's the complicated part. There are hundreds of implant systems in the world. Different brands, screws, connections, components, and many of them are not compatible with each other. So if you ever get an implant, you should receive something called an implant card. It's like an ID for your implant. It contains the brand, the size, and the type of your implant. And this is extremely important to keep safe. Because if you move or go to another clinic or need repairs years later, the dentist needs that information. So always keep the implant card or take a photo of it and save it on your phone and computer. Because without it, getting spare parts later can be very, very difficult. And not everyone should get an implant. There are absolute contraindications and relative ones. Absolute contraindications are situations where implants are usually not recommended at all. These are severe immunosuppression, uncontrolled diabetes, ongoing cancer treatment, certain medications that affect bone healing, and age under about 20 to 25 while the jaws are still developing. In these cases, the risk of failure becomes very high. Then there are relative contraindications. These are situations where implants are possible, but the risks are higher. The most common one is smoking. Smoking reduces blood flow, slows healing, increases infection risk, and raises implant failure rates. So before getting an implant, a proper medical evaluation is absolutely essential. Because sometimes the best decision is not to place one at all. Now let me be very clear. Implants are not bad. In many cases, they are the best solution available. They preserve bone, they don't damage neighboring teeth, they usually feel very natural and can last decades. But only if the patient understands what they are getting into and takes proper care of them. But whether or not you have implants, the most important thing is still your daily oral hygiene. And for that, I've made a simple oral care routine guide you can download in the description. It's completely free. And if you like this video, I'm sure you will love this one. I'll see you there.